Hi, Dr. Masumi here, board-certified oral surgeon in Northern California, a pioneer in robotic surgery in the maxillofacial region, in the head and neck, with a robot we call YOMI. First one in 2018. And I want to just kind of go over with you a little bit how the system works. And this is the most commonly question that I get is that, do you just press a button and then the robot does everything? No, that's science fiction. The FDA would never approve something like that where it's fully automated. So it's basically surgically assisted in a very similar fashion as a Da Vinci robot that's used commonly in the medical field. This is very similar to that. So it assists me in surgery. And the YOMI itself has got a built-in guidance technology, which you can kind of see on the screen, which uses a patient's CBCT to be able to know exactly where everything is in 3D. So the sinuses, the nerves, the teeth, and everything else, which are all the things we try to avoid. And then it has a second arm here. This is the arm that attaches to the patient. So if we're going to just pretend like if this is a patient, this device here, which we call a splint, attaches to the patient's mouth or teeth. And then this is the second arm, which does all the drilling. So we're going to kind of, it's in a free position now, so you can kind of see that as I move it, you can actually see it in the screen and where it's actually moving. So as I move this, you can kind of see that it moves also in the screen itself. So that's basically how the robot knows where to go at all times. And then go ahead to maybe guide it, please, if we can. Yep, got it. So, yeah, good. Perfect. Free, good. And then just, yep, and then just hit pause. Good. Yeah, so it allows us to basically, in three-dimensional spacing, be able to know exactly where we need to put things. And then the beauty of this system is that we can use any implant system to be able to basically use the same technology to place the implants guided. And the biggest benefit to this technology is what we call immediate implant placement, where patients come, same day that the tooth is extracted. If there is enough bone, and if there's anatomical landmarks that provide us for that, we'll go ahead and immediately put the implants in. So in the old days, it would be impossible for us to do this. Most people that do implants these days, they freehand it, which leads to a lot of the complications that we typically see. So one of the biggest part of my practice is actually implant removal, believe it or not. And that's the main reason why I don't put any implants in that are free-handed. We're almost always using guided technology, which is basically using YOMI. So that's a overview of our YOMI, which is the first one again in the country. Thank you so much.